That was the first thing that woke me up as a dentist, that I just realized that that it's incentivized disease care. It's not healthcare. Let's stop calling it healthcare. It's disease care. So to get the conditions right in the body, it really boils down to the gut and the gap junctions, okay, and the leaky mouth, leaky brain, leaky gut, leaky sinuses, leaky tonsils, leaky teeth. Okay, so it's leaky everything.
All right, so we turn now to a panel discussion. We got a couple of questions from the box in the back. And I failed to say during my remarks how much I appreciate Dr. John's staff as well, and the folks that work here and make all this happen. So this place, John brought me in here right after he bought it, or right before he bought it, and we walked around. He had this vision, and I was like, that sounds like a cool vision. Not sure how you're going to get there, but you did. So I'm going to point the first question at Dr. John, and the question is this: how are VSELs administered for the hearing loss treatment? And then it says direct injection question or IV infusion question.
Yeah, so VSEL stands for very small embryonic-like stem cell. And it's something that I think is probably one of the best forms of stem cell therapy. And they discovered that you have all of these tiny stem cells that are pluripotent, meaning that they can turn into virtually any type of cell. And they're small enough where they can go everywhere. So they can go through the blood-brain barrier, and they can literally go wherever you want them to go. So they're trapped in your blood, right? Really interesting kind of point that I bring out in the recent book that I released, It's All in Your Head. It's mostly on endonasal, but I get into some concepts of meditation because Joe Dispenza is doing some research on why these meditators are having these spontaneous healings. There seems to be this activation in some sort of life force where people have a short-term healing and then more long-term. So people, their tumors will melt away, or you have people in wheelchairs with strokes that get up and start to walk. So they've looked at the blood and they found that there's just tons of these tiny little particles. And so their initial ideas with that is that they're exosomes. And so the way stem cells work is that when a stem cell is homed into an area, so when we have an injury, it attracts, it like sends out like a beacon for the stem cell to migrate to the area. And then once it gets there, it has a stickiness and it attaches there, and then it starts to shower these exosomes, which then shower the existing cells and tissues, which then go into like a youthful repair phase. And that's really how it works. It's not as much as what we thought, where the stem cell then starts to turn into different cell lineages. That does happen, but it's more through the exosomes. So they're kind of thinking more that it's this exosome effect. And once I started I met Todd Okovides out in Carlsbad, who's really pioneered the use with this laser that's it's like a 0-point laser. They call it scalar, but it's very unique in the way that it works. And so the laser, we pull the patient's blood, we spin it down in a certain way, and then we activate that blood, which liberates and grows all of these V cells. So it's from your body, it's completely safe, and we can run it as an IV, and then we can take that same laser and use right angles to basically home them into specific areas of the body. The ear, different parts of the brain, pituitary, the thyroid, adrenals. We did a whole protocol on Ben. So this question's kind of asking, like, how do we use the V-cell with the inner ear? My answer would be both. I had to kind of give you the background so you kind of understood exactly the context behind it. But so we directly injected. It's called a transtympanic injection, which is kind of a typical injection that an ENT would do for like a steroid for a kid. Very common. So it's an injection like that. And then we take the laser, activate it, and home it in after an IV.
Yeah, thank you for that. And do any of the other panelists have anything you want to add on to that?
I'll throw in a quick clarification. I actually had somebody super concerned reach out to me when we were doing the Instagram video yesterday of the V cells, that these were embryos that had somehow been killed, human embryos, but it's very small embryonic-like stem cells. So first of all, for any of you concerned about the ethical nature of these, they're not harvested from embryos. And second, John's actually lying about the exosomes. They're actually government nanobots. I also wear tinfoil hats.
All right. So whoever asked that question, did that answer it?
One question I didn't ask. What's the source of these stem cells?
Yeah, and we'll repeat questions that are asked from the audience because we are recording this. The question is, what is the source of the stem cells? It's human-derived tissue. John, do you want to expound?
Well, the exosomes that are typically used in doctors' offices are, they take placenta and they stress them in a way that the stem cells in the placenta kind of bud off and shower the exosomes into like a sterile, like saline solution, and then they use those. The VSELs, like I said, they're basically, it's a blood draw, so it's be no different than if you got PRP. So a lot of people by now are familiar with platelet-rich plasma. So it's a blood draw, it's spun down, and then it's activated with this specific laser.
So if you're to do a V-cell procedure, the first thing that's going to happen is you'll give a bunch of blood, and then that blood is treated to activate the V-cells, and then they go wherever it is that you want them to go.
All right, so the next question we have here is, does eye protection need to be worn when using near infrared light? And I'm going to direct that down to Ben, if I can, and then we can follow up.
I'm certainly no expert on infrared light and the interaction with the eye, but I do know that about 600 to 800 nanometers is actually something that can be good for myopia, can be good for the retina, and I think that the fact that a lot of these manufacturers are covering their butts by sending out like the little tanning glasses with their red light devices has kind of like spread this rumor that you got to be careful with them, but it's a lot different than the concentrated lasers like the FDA, what are they, class 2 medical devices that John might use here in the clinic, like the home light panels, infrared light panels, stuff like the Juve, things along those lines. You don't need to wear eye protection. I suppose I should probably have a little asterisk
Disclaimer.
for reducing any type of litigious action, but yeah, I'd never use eye protection unless it's like an actual concentrated laser in a medical facility.
Yeah, when we do the V-cell and we do our protocol, especially if we're doing like brain, we go right into the eye. You remember when we did yours?
Yeah.
You stare right at the laser that goes in the eye. And it's really amazing the response that we've had with patients with vision.
Yeah, you feel your brain just turn on. I mean, similar, who used the B-light today? The infrared light for the head, and then it also has a nasal probe. And that thing, you very, very similarly, you can feel that photobiomodulation coming straight into the neural tissue through the nose and on top of the head. And that company, by the way, they have a newer device called a Duo, where you put on the cap, but then they've got a second device that attaches to the back of the head to do the vagus nerve, and then a second probe goes in the other nostril. So you got a probe in both nostrils, the light on the back of the head, and then they also ship it out with a gut device, so you can literally do like a full body treatment with the V-Light at home now, which is pretty cool. / according to my wife and children, makes me very hard to snuggle with in the mornings.
Any other comments on the red light?
I would just add that in general, the LEDs seem to be very safe for eye consumption. I would also say that there's one of the major laser manufacturers, they're working on treatment for glaucoma right now, using laser, actual laser directly into eyes. So I think the jury's still out right now. But like he said, Ben, cover your butt in the clinic is probably worthwhile. But I think we'll see in the next couple of years that stance changes, and we're using it more and more that way.
All right. The next question is methylene blue. How much daily? Cycle on and off? Question mark. In what form? Question mark. Capsule? Question mark. I'm going to ask John to start with this one, but maybe we can go down the line.
Yeah. So methylene blue, the dosage is 0.5 milligram up to 4 milligrams per kilogram of body weight. So 80 milligrams is a pretty roundabout number for most people. you know, 40 to 80. We have the Lumitol Blue, which is a square, and it's half of that is about 80 milligrams. That's pretty often what I recommend to a lot of my patients, and that seems to be really helpful. You do want to take a break every so often. Typically, I'll recommend people do 10 days on and 3 days off. You know, there's some variations that you can have within that. I mean, it's not like a set in stone thing, but what happens is the methylene blue has an affinity to the mitochondria. And that's why they use methylene blue for staining like brain tissue, because like the nerves become like super blue, so you can see them in contrast to other tissues. So it rushes in that mitochondria. And so if you're taking it every day, there's a buildup that can occur in the mitochondria. And I've hit that threshold myself, and it's kind of like you get a little fatigued, right? And then you take a couple days off, then you take the methylene blue, and it's like, boom, everything's working again. So it's not like you get into a danger situation, like life or death, but it'll begin to start to have an opposite effect.
What might be useful too is just to ask, you know, give an example of maybe how you've benefited from it.
Yeah, well, it has been profoundly helpful for me personally. And I like to do things myself before I start recommending it to my patients. So like all the stuff that you guys have experienced, I've like, you know, delved deeply into and find it to be beneficial personally. But with methylene blue, I just feel like I have a lot more focus and attention, and it's from a place of just being happy and optimistic, you know, so it works kind of like an SSRI in that sense. And the reason that it helps mood is that it kind of mops up nitric oxide. And they've done studies where they found that people that have depression, if they raise their nitric oxide, the depression and the mood gets worse, right? If they lower the nitric oxide, it's like completely related, right? So nitric oxide, and like for a lot of people working out, I'm not opposed to it. I think it can be beneficial to cycle it, but I don't think that it's something that you should take every day, all day, you know, because it has a lot of negative consequences to it.
Yeah, excess nitric oxide can certainly cause a little bit of like an excess free radical response. Couple of thoughts about methylene blue, and John, don't kill me for saying this, but it is, you know, it's like a fish tank cleaner, right? It's kind of like ozone, right? These are cleaning agents to a certain extent, and so I think that overuse, you know, people who are doing, you know, frequent, let's say like rectal insufflation of ozone, which I know everybody in here does every day, or regular oral use of methylene blue or rectal use of methylene blue, I think you could reach a point where you can actually kind of like clean out the biome too much, right? Almost essentially create a situation which you might not have enough good bacteria. That's theoretical, but because of that, I'm a little bit careful with excessive use of ozone, excessive use of methylene blue, kind of like this whole healthy hygiene hypothesis, the idea that exposing a child to a wide variety of fermented foods and farm animals and things like that help to build up dirt and bacteria and gunk in the body that renders the immune system stronger. I think you should be a little bit careful with excess, you know, cleaning agents in the body. But like John mentioned, it is fantastic, especially when combined with photobiomodulation as kind of like the ultimate smart drug combo. The other thing you should be aware of is that when we're talking about things that interact with light in a favorable manner, I don't recall the book on melanin, but there are certain melanin precursors that also work really, really well when combined with infrared light or sunlight that can also be combined with methylene blue, namely shilajit and chlorella, like the dark greens, the dark blacks of the plant kingdom, along with the dark blues, seem to interact really, really well with red light. And you know, I think that we'll probably see over the next decade a lot more research done on this concept of photobiomodulation, what to stack with it. And then the very last thing is John did mention that the methylene blue can act a little bit like an SSRI. So if you're using other SSR-like compounds, you could risk excess flooding of the cell receptor with serotonin in the cleft. So you would want to be careful with what you combine it with, especially if you're on some type of SSRI-based medication. Just make sure that you don't take the methylene blue simultaneous to that.
All right. Anything else?
I would just say I use methylene blue more as needed. So if I have a lot of writing to do, if I have a lot of studying to do, I love it as sort of a focus and concentration piece like that. So I don't tend, I might take it for 5 days or 10 days sequentially, and then I might not take it for 2 weeks or 3 weeks. That's just my own personal use. I definitely cycled it more like what John's saying with certain patients, especially, mitochondrial dysfunction, and we're trying to run the machinery of the mitochondria in various ways. So we might do some methylene blue red light cycles, then we might do some hyperbaric oxygen and hydrogen cycles. So, we're running different systems in that mitochondria purposefully, and we take breaks between different pieces of that so that we're not running any one of them sort of into the ground too much. And then I think over time, to some extent, like let's say high dose blue too much, you don't want to clear that out periodically. But also there's pieces of this, like with oxidation factors, the body gets more resilient, right? The whole hormetic effect. So there's a balance between pushing the envelope too far, where you're starting to clean things out too much and starting to over-oxidize and break things down. But if you reel that back a little bit and you just get enough of that stimulation, where at the end of the day now, the body starts upregulating superoxide dismutase, the body starts upregulating glutathione and catalase, all those natural antioxidants, it makes us more resilient to all the other stuff in the world that we have less control over. So I think it's like anything else, it's just a delicate balance. Everybody's going to be a little bit different that way, and it's important to spend the time to figure that out with each person.
Well, what's the cycle length are you talking about when you're talking about methylene blue?
The question is, what sort of cycle length are we talking about when we're talking about a course of methylene blue? John?
So that's it for
I think.
Well, if you get sick, you feel like you're coming down with something, that could be a good time to even possibly take significantly more than what we mentioned. As I mentioned, you could even go higher than 4 milligrams per kilogram, but if you had cyanide poisoning, you went to the hospital, they would run an IV with exactly that dosage. We've done IVs with even higher amounts of that. So the safety is actually higher than that. There are certain procedures, such as a thymectomy, and they give intravenous methylene blue at 1,000 plus milligrams. And this is where the whole controversy with SSRIs came about, because there was 5 cases that had these massive doses of methylene blue, and they died from serotonin storm. So although I appreciate Ben's comment, because it's probably a safe comment to make, but there's a little controversy with it. The Mayo actually came out and retracted that concern about SSRIs with methylene blue, except for just with this surgery, and the whole country of Canada did as well. So it may not be as much of an issue as was thought.
Yeah. Anything else? All right. So we're going to start with Alan on this next one. Pardon?
What is the dosage that you're using in IV versus the oral or rectal form?
The question is, what is the dosage being used in the IV versus the rectal form? I realize you can hear them, but for recording all of these.
Thank you, Ben. Well, so we go up to as high as 500 milligrams, between 300 and 500 milligrams with some of our IVs. We do a slow IV. We like to prime that with silver. Both silver and gold have been shown in the research to greatly enhance the photodynamic aspect of methylene blue. So, and silver just by itself, anti-inflammatory, it's very antimicrobial. A lot of the patients that we see are sick. I can't tell you how many people I've seen that have been really, really ill with the current virus. And just while the IV's running, they're like, what the heck's in this stuff? So it can be quite dramatic. And it's sad to me, because this stuff should be at the hospitals. Like what we do here, IV ozone, these things have been around for so long. There's so much research backing them up, and it's just bizarre to me.
You
Following.
mentioned this morning a cleaning agent to clean up the stains from it.
It's on the counter right behind
There
you
is a
there,
cleaning
that
agent.
spray bottle.
If you hold it up, I can say it into the microphone. It's not Clorox. There's a little white bottle. It says like messy something on it, and it's the way to keep your spouse happy if you're pooping methylene.
So you can get this on Amazon. this is the big problem with methylene, but we have a suppository as well.
What's it called? Stain?
Miss Mouth's Messy Eater, Stain Eater, and you have like blue right there, right? So it's like, it's hidden on this. But yeah, go on to Amazon and you spray this on and it gets rid of methylene blue on any material. It's fantastic.
Mouse, messy, stain, what?
Miss Mouth's Messy Stain.
It's probably a good find also for breastfeeding moms whose children develop thrush. They'll use gentian violet, and we used to use that. My wife and I have horrific gentian violet, purple staining everything accidents. So this stuff would probably work well for that as well.
Yeah.
It's a good find. Yeah, we need to buy some stock in that company now. Pros and cons of a troche versus a capsule versus other delivery methods of methylene blue. What do you think, John?
Well, you know, the IV obviously is definitely getting in there. The suppository is nice because it's a slow release. So there's some benefits of that. The oral delivery really works great. In fact, when it's mixed with stomach acid, it enhances absorption. So if you don't want your mouth to get blue, you know, you want to take something that can get, you know, into your throat and down your mouth. But the oral's fine. Yeah. The sublingual, those don't seem to have the absorption. This is according to some of the experts, you know, when they're asked all the delivery forms, seems to be orals the
How many days on and off for the
I would
oral?
recommend 10 days on and 3 days off as a rule of thumb.
All right, let me go to the next question here. From a physical, medicine, and rehab perspective, what are the top 3 devices for acute care, pain relief, and subsequent healing? And I think I'd like to go to Alan first, since we've underutilized you here, my friend.
You know, I think I'm going to defer that question to somebody else.
So the top 3 modalities for pain relief?
And healing.
Okay. Should we just rapid fire each of our top 3?
Yeah.
All right, I'll go with things that I personally would use at home for injury, for inflammation, or for relatively rapid pain relief. Let's say things that wouldn't fall under the category of like supplements or medications, you know, because obviously there's everything from, you know, opioid mimics like kratom to tuberosaccharides, curcumin, to all sorts of things you can take orally. But I would say as far as modalities to have around the house, I think that pulsed electromagnetic field therapy is fantastic, especially if it's at a high enough power. I realize it's expensive, but I own one of those pulse centers, PEMF tables, that has the ability to attach coils and pads into it. And that thing is just like lifeblood for me when it comes to management of injuries and little aches and pains. So that's one that I use probably every day. The second would be cold therapy, cold soaks, cryotherapy, or anything involving cold. It just seems to do a really, really good job, not only with pain management, but also some of the nervous system resilience that allows you to kind of like manage your pain a little bit better. And then one that kind of flies under the radar, there's a light sound stimulation machine called the Brain Tap. And the Brain Tap has like 800 different recipes and sessions on it, but there's one section, if you were to own it and scroll to the library within the app, called Pain Management. And it literally teaches you how to use your brain as its own pain-killing pharmacy. And I kind of scoffed at this the first time I heard it. And then I went through the sessions, and it teaches you some really cool breathing tactics and almost like a little bit of self-hypnosis to manage pain. And that one, because it's such a versatile tool, I think it's a really good unit to own anyways. Has anybody ever used the Brain Tap before? Yeah, and it combines well with a lot of the modalities here, like hyperbaric and sound therapy and all sorts of things. So anyways, I would say PEMF, ICE, and the Brain Tap.
Nice. So Alan, if I were to ask you, if you sprained your knee, and what would you do at home? The top 3 things.
The temperature cycling, I would probably start there, like hot, cold would make sense. I really like the idea of that the area needs to be agitated, so it'd be helpful to introduce a kind of vibrational patterns into the area, I think. And kind of application of energy. So I could imagine like photonic therapy being helpful there, and vibrational therapy, mechanical vibration, hot and cold, I think. That seems, and then kind of gently be stretching it and relaxing it.
Beautiful. Jason?
I would say for pain, I would separate those categories. So I would say for pain, I would look at PEMF, cryo or cold of some kind, and then mechanoreceptor stimulation, helping to block the actual pain messages. For regeneration, I think I would say, to me, that's an energy production issue, right? So the two things that, salamanders, I love salamanders, right? I'm sure you guys do. So salamanders have two things that they do better than we do. The first is they mobilize stem cells way better than we can. Actually, there's three things. They lower inflammation better than we can. And they upregulate their oxygen better than we can. They actually have algae that grow on them. And algae are photosynthetic, so they create oxygen. So the algae migrates to the area of injury and produces oxygen in the area while they're upregulating stem cells and reducing inflammation. So I would look at that and say, clearly that's a regenerative model we should try to mimic. So oxygen. So for me, that would be hyperbaric, obviously. I might be partial to that. Red light therapy from a mitochondrial, cytochrome C, all the good things that would do for us. And then I would just look for other mitochondria, so either methylene blue or hydrogen, things that help generate the energy concentration required for massive ATP production, energy production. So.
Right. It seems like there's two ways to answer this for me. There's one, like what would I do in the clinic that might be difficult for people to do at home because I've got access to really expensive equipment. And then something I could do at home. So
I would just go to John's office.
Just come here. If I was at home, I would say cold would be number one. And I have a cold plunge. So if you don't have a cold plunge, you get one. Even if you get like a freezer and turn it on the side, it's something I use every day and I absolutely love it. So if I have pain and I want to get rid of pain, cold therapy, 20 minutes on, 20 minutes off. If you alternate that with heat, it can really help flush the area. And then like one of these photons would probably be my top choice as far as like a light. It's very healing. You could do ice and then apply the photon to it. I think that would be a really good system. And then melatonin, because that's when your body's going to really repair itself. That'll address the mitochondrial issue. We prefer that as a suppository. That's the best delivery. It delivers slowly throughout the night. It's a Sandman. And if I were to come to the clinic, I would probably say laser, like a class 4 laser treatment. And then the sound wave device that we talked about, the soft wave device. And then I would probably say probably chiropractic adjustment or some sort of manipulation to the area if that was indicated.
I have a few more thoughts real quick, if I could. I recently had like a toe inflammation, and to manage pain at night, I literally just used those lidocaine patches. So that's another one that flies under the radar, is literally just like a lidocaine patch you can slap on a painful area if you need to sleep without having to take a pharmaceutical. And then this is an old school tactic I learned from a doctor. He used to work with a bunch of Tour de France cyclists. I learned it like 10 years ago. I kind of forgot to mention it in my earlier response, but I used to use it all the time when I was racing Ironman, and I still use it if I get some kind of like chronic repetitive motion injury. And it's something I talk about in my book. It's like 3 steps. A, you apply a transdermal anti-inflammatory topical, like I like magnesium lotion, CBD lotion would be another example, or a Tramiel would be another example. Then you slap electrodes on top of that. I think one of the better devices out there is called the Mark Pro. It's like a home device that'll do transcutaneous nerve stimulation, but then also electrical muscle stimulation. And then you wrap that with ice. So it's basically transdermal plus the electrodes plus the ice. And the way that works is the electrodes help to drive the transdermal deeper into the tissue. And then the ice allows you to jack up the intensity of the electrical stimulation a little bit higher. And that done a few times a day, like for me when I get an injury, seems to work really, really well. And the only thing I'd throw in there is if you do have access to like injectable BPC 157 or TB 500 as peptides, you can do that beforehand as well. And I realize it's a lot of stuff, but as anybody in here who's active knows, like if you're laid up, you have pain, you want to get back in the game fast, sometimes it's a matter of stacking some of these things. And you know, you can just do that while you're eating a salad for lunch or whatever.
Yeah, that kind of brings me to some thoughts too. CBG can be really good for pain, CBD, but I think CBG is better. And a full spectrum CBG. So it's kind of, they call it the mother of all cannabinoids. And so some of it turns into CBD, but it's activating more of the cannabinoid receptors than really any other substance. The other thing, there's a substance, it's a Chinese herb primarily for pain. It's called Corydalis, Yohan Sui, I think. We have, I don't think we sell it like on the site, on the Mitozen site. But we do give it to our patients. I have never seen anything work this well for pain. It just, and even, I mean, severe pain, throbbing pain.
Could you repeat that one more time, John?
Corydalis, Yohan Sui.
Corydalis, Yohan Sui?
Yeah.
If I do put this panel discussion out on the podcast, I'll hunt down the spelling and put it into the podcast show notes for people.
We have it in a suppository called Solace, right? And if anybody wants, they can just reach out to us or email us.
It's called Solace?
Solace, yeah. So when we do regenerative medicine, we give patients the suppository. They can either take it orally or rectally. And it's, you know, I mean, you could be just suffering in pain and like 20 minutes later, you're like, you know,
does it have that Chinese?
And there's no hangover. You take it, there's no constipation.
Wow.
It works, but honestly, like like Percocet, you know, and some of those pain medications, you don't really feel good on them, right? And they don't really get rid of your pain. They just kind of distract you from it. This substance should be the standard of care for pain. But the one caveat is that it will make you a little drowsy. So it's more ideal for nighttime. It's not something that you could take during the day.
Do you sell that on the Mitozen website?
No.
Solace?
No.
So someone would need to call your clinic to be able to get it?
Maybe we ought to get it up there.
Yeah, I mean, it sounds fascinating. Raise your hand if that's something you might keep in your medicine cabinet. This is the first time I've heard about it. It sounds intriguing. Yeah.
All right, so got another question here, and it asks how to activate pathways to balance circadian rhythm. And so I think, Alan, is this...
Sure, yeah, happy to.
Perhaps,
yeah. So, circadian rhythm is triggered primarily by because we evolved here on the planet, and we kind of share a lot of DNA expression with other creatures that are. We've evolved this system that orients us to the day as a consequence of sort of first light. And so there's a cycle that is developed. It kind of looks like this. Around 6 a.m. it's like this, and then the cortisol levels rise in our body, and there's like a little peak maybe around 11 a.m., and then it kind of comes down. There's like a little dip like this, and then it comes down, and it cycles like that. And if you look at that cycle, that's a 12-hour period, this one, and so the full cycle is 24 hours. And if you look at the reason I'm saying an orienting response is because there's a whole cascade of hormones that happen with the production of cortisol in the body, everything right down to estrogen and testosterone for males, and it's exactly this cycle that looks like this is exactly the same cycle that is in a fruit tree for photosynthesis, and so that's also an orienting response for the tree in terms of how it produces food and everything. And anyway, these kinds of mimics, they are very broad as a consequence of all of us, all the living things having evolved here on this planet. So the question was really about the sensory input. It was a question about how to drive that circadian rhythm. Is that the question?
Yes.
Primarily with sunlight. However, it's what you call an experience that it's emphasized like any rhythmic function in the body. If you time additional stimulus to occur at the time of specific points in the cycle, you can emphasize and lock it down. So there was the subject of Agnihotra came up today. And so this is an Ayurvedic ritual. It's very ancient. It involves the burning of cow dung with ghee on the top of it. You do exactly at sunrise and exactly at sunset. And this is a circadian rhythm synchronizer is what this is. It's a very visceral experience. It's multimodal. You have the heat of the fire, you have the flickering of the fire, you have chanting, it's about 12 minutes in total, and it's very precise. You do it very precisely at these times of the day, and there's, anyway, it's under study right now at UCSB in the psychophysiology department, this particular modality. So I guess, and there are other traditions too, like yogic traditions, like
that one sounds like bullshit to me. Sorry, go ahead.
Oh, it's okay.
Cow dung.
Like sun salutation might be a good example. Another one of like a multimodal, a kind of process or methodology that's associated with the rising or the setting of the sun. So anyway, that's how I think I would go about doing it if I was interested, like to really clearly identify the circadian rhythm or specify it.
Yeah, thank you, Alan. Any other thoughts from the panel?
I think it's a complicated question because that rhythm is pretty delicate and it is driven hormonally, cortisol, melatonin. I mean, there's so many pieces of that. And for the most part, maybe not here because you guys are such perfect human specimens, but out there in the world, sympathetic drive, stress drive is out of control, especially now more than ever. And it's been that way for as long as I've been here. So, cortisol is driving that. And people, if you start running labs on people and you start looking at their hormone levels, their cortisol levels, their pregnenolone levels, you just start understanding how depleted we all are. And, I do believe, I 100% agree, I'm a early to bed, early to rise. I catch sunrises. I love trying to connect that way. I think that that's a big piece of my attempt at managing my own stress levels and cortisol levels, connecting to the earth. But that also could be like using PEMF to connect to certain rhythms, right, electrically. So I think there's a couple pieces, reduce your stress, / become more resilient, right? The stress is like in this bucket, right? Your bucket is filling up and eventually, most of us are overflowing. So in a lot of ways, we're all looking at like, how do I empty that bucket? How do I remove these stressors? And in some cases, that's very easy to do, but in most cases, it's not. And so sometimes, 16 ounces of, let's just say 16 ounces of stuff in a 16-ounce bucket, that's full, right? But are you as healthy as you could possibly be? Because 16 ounces of stuff in a 32-ounce bucket doesn't feel so bad. And so your health and your resilience, your ability to get healthier in spite of the stress that you're all facing, and we're all facing, helps shift how our body starts to respond to those levels of stress, even if we couldn't reduce the actual amount of stress. So I think it's like everything else that we're doing, it's a multi-dimensional approach. Get healthier so that you're more resilient. Find the stressors that are easy to address and figure out ways of reducing them. Connect with people who have strategies. Connect to devices that help fill in the void that we can't do because of the life and the world that we live in. And I think eventually you might get a little closer to connecting to that circadian rhythm.
Yeah, beautiful. Yeah, I love the Agnihotra suggestion. I remember when I first met Alan, we were in Santa Barbara, and we sat there, and I just was blown away. I'm sorry?
You burned cow poop together?
Well, we were at a hotel. Was it like the Ritz or something there in Santa Barbara? And they were going to send a tech out for the chair that you guys experienced, and they couldn't find a tech, so they sent like the top guy, right, the guy that developed it. And so we had just a wonderful conversation. And so, for me, doing that ritual would be ideal, right? But let's face it, we have busy lives. So what I started to play around with was the photon and putting that on in the room. And I think that that's a good compromise, right? Because the essence of that is this strong signaling that, hey, it's time to wake up. And then also, hey, the day's winding up, right? And it's time to switch into more of a parasympathetic. So your cortisol is your stress, right? That wakes you up, it gets you going, allows you to get things done. At night, melatonin is what cortisol is during the day, what melatonin is at night to put us in a parasympathetic state. So you have sympathetic during the day, and you want a strong parasympathetic activation, which is darkness. And that's why you don't want a lot of bad light in your house. Like, I don't use the can lights. You know, I have lamps with red lights in them. I have a red rope light. I think I got you on that deal as well. It looks like a submarine in my house, and it's so calming. And when you start doing this, you start to go to other places, like you go to a friend's house, you're like, how are you dealing? Like, this is crazy. I'm so activated, right? So I think after the age of 40, I think everybody should really seriously considering supplementing with melatonin, not just for the sleep, but for that powerful activation of the parasympathetic nervous system, because we're also sympathetically activated. This is one of the primary causes of a lot of diseases right now, because it's a stressor that we just haven't adapted to, right? I mean, we're just too busy. There's too many toxins. Our guts aren't healthy. You know, you just go on down the road. EMF, light pollution. So the best thing I would recommend is when you wake up, one of the easiest things to do is go out and sun gaze, look at the sun directly, right? And that's going to be a really powerful, and then you can start getting into using the photon in the morning, in the afternoon, or at sunset, and that can be really helpful. Maybe supplementing with some melatonin. You know, those would be my suggestions.
Yeah, I would agree with everything. I was actually going to mention before John did the idea of your light environment and the concept of light pollution. I mean, everybody look up right now and tell me that looks just like sunlight. Not really, right? Stare at it for a couple of seconds. Go ahead. Tell me what your retina doing. Did it kind of start to jam a little bit? That low-level flicker, even if you're not looking at it, you're bathed in that. In many lighting environments, that overhead fluorescent lighting. How many of you in here actually know what lighting is in the cans in your home? Yeah, like a few people, maybe 20%. Right? So basically, you need to go through your house, and it needs to be either incandescent, preferably red incandescent in areas of the home where you're sleeping, although Biden, bless his heart, is now trying to outlaw all incandescent, I think, starting here in a few months. So stock up on your bulbs. The main reason is that they're energy hogs, but I think it's worth the circadian rhythmicity, the trade-off for a little bit extra money you'll spend on your energy bill. Halogen is also really good, as are some of the newer forms of low flicker OLED lighting, whether that be your computer monitor, like BenQ or ISO, EIZO, are two good brands for computer monitors, apps like Iris on the actual computer itself, and then basically going through all your sleeping areas, preferably master bedroom, master bathroom, kids' sleeping areas, etc. To replace everything with a real nice soft red light or amber light, and then in all the other areas of the house, incandescent if you can do it, or halogen or OLED, preferably with no dimmer switches, because the dimmer switches kick off a lot of EMF. So a lot of people would be healthier and they would sleep better if they just did a lighting audit of their home. It'll take you like one Saturday afternoon to do, right? And then you've got a really good setup for the rest of your life.
That's good. So one of the questions was about oral hygiene, and John, I'd like to kick that over to you.
Yeah. So we talked a lot about that. I mean, it's kind of on and off throughout the day, and you mentioned about how important that was with some of your fillings and root canals. And you know, it's really such an important part of health and healing. I have this idea of taking care of your doorways, right? So Ganesh is the Hindu lord of doorways or new beginnings, so I call it the Ganesh protocol, right? And so this is basically taking care of your nasal, your oral, and your colon, right? These are the three primary doorways that create inflammation in the body. So what happens is you have microbial growth that release something called endotoxins. And these endotoxins are incredibly inflammatory. And this is really linked to just, you could almost point to just about every disease and have some connection with this influx of endotoxins. So we don't really talk much about sinus hygiene, right? People talk about brushing your teeth and flossing, blah, 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 but who's talking about nasal hygiene? So that's why I think, using a neti pot, I formulated something called glutastat, and we have it where it's in a mist, and I recommend a 30-day sinus protocol when I first start working with people. And they'll use this mist 4 times a day. And we actually test people for something called Marcons. I think you were,
Yeah, you
you
did.
had a pot, yeah. So we find it on like 70% of the patients we test. It's a really nasty infection. Probably a lot of you here have it and just don't know, but it's hard to get rid of. So you got to do something somewhat intense for 30 days. We have the 30-day sinus protocol that we can make available to everybody. In fact, we'll email it to you as a follow-up, and we can also attach it with the podcast. And so after you do that 30-day sinus protocol, you got to do something to kind of do like a daily practice where you do it like once a day, you keep it in your car. And then for oral, I'm going to bring a friend up in a second here that can talk a little bit more about it. But what I have is this essential oil blend called Bocazen, and I have people put it in their mouth, move it all around their gums, and then take a toothpick and kind of push it between all of the teeth. And then obviously for the gut, you have to look at your microbiome. So, I think one of the best ways to address that is with the ProBioZen yogurt recipe. And we'll also make that available to everybody and make sure that that's in the show notes. And John, would you come up? John Osberger is one of the top. I can just maybe bring. He's one of the top biological dentists in the country. He's got a 20,000 square foot facility. I thought mine was pretty big at 15,000. And has a similar setup here where they have cooking classes and they have events, and anyway.
We have a chef in a garden. Food is our model. So it's my wife, Allie, and I, we're from Denver. We have the Human Universal Health Institute in Denver, Colorado. It's huhinstitute.com. I am biodentist.com. I've been a biological dentist over 30 years now. I became a dentist because of my dad. He was an orthodontist, so I started out as a lab technician, became a dentist, realized that I am nothing but an insurance-driven tooth mechanic. Okay, to me, it seemed like earlier in my career that it was all about the repair. It is not about the disease, right? So choose your dentist wisely. So where I'm at right now is I'm training doctors and dentists and healthcare professionals to see the mouth in a way that is in a coherent way with the rest of the body. The question is about oral hygiene. So I'll say this, the one thing about oral hygiene, when you go to the hygienist to get your teeth clean, what I call that is removing the evidence, okay? So if you're having biofilm build up in your mouth and you're going to get that all scraped off over and over and over again, and for some of us it comes back a lot faster than others, right? And that is because the body's in an acid state. Acidemia is going to have a calcification effect, where if you have tartar buildup on your teeth, what are the other calcification diseases in the body? Cataracts, gallstones, kidney stones, breast cancer. The list goes on. So when I see a patient that's got all of this inflammation in the mouth and all these biofilms, what it's about is really getting the body in harmony with the mouth and getting the conditions right, okay? Because if the conditions aren't right, say that there's whatever is creating inflammation. Inflammation is an acid-producing event, right? So you're gonna have dental disease if you have inflammation in the body. It becomes this vicious cycle, because then if you go to the tooth mechanic and you get metal in your mouth, you get the dissimilar metals creating the battery effect, okay? Because that's what dissimilar metals in a wet acid environment, that's battery, okay? And then we had to talk about the root canals. Okay? You mentioned this book. So this is a patient of ours on the cover. I'm Tom Levy's dentist. I've been working with Tom for about 25 years. I was one of the 12 dentists that did the research on root canals. I used to work for a guy named Hal Huggins. Anyway, long story. I got involved in biological dentistry a really, really long time ago because I really felt like I noticed I was harming patients because I would do something routine to one patient and get great results, like a filling. And then I'd do the exact same procedure for somebody else and they'd have pain. Okay, so what's the difference? The conditions in the patient's body, right? So that was the first thing that woke me up as a dentist, that I just realized that that it's incentivized disease care. It's not healthcare. Let's stop calling it healthcare. It's disease care. All right. So anyway, so to get the conditions right in the body, it really boils down to the gut and the gap junctions. Okay, and the leaky mouth, leaky brain, leaky gut, leaky sinuses, leaky tonsils, leaky teeth. Okay, so it's leaky everything. So really, we developed a protocol. My wife and I trained in Switzerland. We found a private healthcare system in Switzerland where it's all biological medicine. And it's really about getting the biological conditions right in the body while we're doing the process of getting the hostage situation out of the mouth with dead teeth. When I became a naturopath, I did my thesis on how to keep teeth alive. And that's a conversation. A tooth is the only body part that can't swell, right? So the swelling is a tool the body uses, right? Just like pain, just like fever, these are tools, okay? And these need to be upregulated and they need to be steered instead of suppressed, okay? So that's why I'm training dentists and doctors right now, to really understand what it is we're doing for our patients, and then working with doctors that are biologically minded to have a protocol to work with a patient as we go through a septic experience called taking the death out, like pulling root canal teeth, and a thing called jawbone cavitations, which is a whole nother conversation about where you get your wisdom teeth pulled. It's a stagnation disease that is in the jaw bone. And it's a really, really, really big deal, okay? And if you've had teeth pulled and not had it properly taken out, like if you had a tooth pulled and they had an open hole, well, that's kind of like a gunshot wound, right? That's a hole in the depth of in the bone marrow. So it's really, what does the body do? And what can we do as surgeons, as biological dentists, when we do surgery in jawbones and we go to that level and we get in there and we're knocking all the biofilm that's out of, the gangrene that's down inside the jawbones. How do we protect our patients through this so they don't have, our patients really just don't have pain and very little swelling. And the patients that swell are the ones that really have more work to do on the excretion pathways and things like that. So to make a long story short, the mouth and the body are intimately connected. And getting the conditions right means that your mouth just really stays clean, right? So it's really getting to that harmonious place inside your body. So that's a long, long conversation. But anyway, I wanted to thank everybody here for having me up here.
Thank you, John. Thank you.
And for anybody who's just listening to this afterwards, listen to the recording, John does have good teeth. So, yeah. Great smile.
Ben, you want to chime in a little bit on that?
I'm pretty sure he covered it.
Yeah, I agree.
Although I guess the last thing I'd throw in is that Biohack stuff that John makes. I usually put that in a little bit of coconut oil in the morning, just swish it all over for about 10 minutes, and then spit in the trash can, not the sink of the toilet, because it clogs stuff up. But that's amazing for coconut oil pulling.
Yeah, the oil pulling is really amazing. It's another Ayurvedic method. You just take olive oil is usually typically what's recommended.
Way easier than burning ghee on top of a cow pie.
Yeah. John,
should we have John back up here to respond to the question?
John, come on back up. Did you hear the question?
Bleeding gums in the presence of COVID?
Post-COVID
long
bleeding gums.
COVID and bleeding gums. Sounds like a fringe question for a dentist.
Leaky gut, leaky gums, leaky teeth, leaky brain, leaky everything, right? Yep. So gap junctions, right? So we got to shore up the microbiome. So the microbiome needs to be diverse. Okay, and that's why I can start going off. Stop using alcohol mouthwashes immediately. Pour them down the drain. Okay, everybody needs to understand ozone, the molecule. You can really, medical devices for insufflation that you want to get to the bloodstream, but really you can buy ozone machines for $50, $60, $70 and make your own water at home, $70. So, my patients, this is something they just get. They get ozone machines. If I'm their dentist, they have an ozone machine. It's required. Okay, it's not an option. So now that's a topical approach in the mouth. You're making water, you're swishing, you're brushing with it, and things like that. But ozone's such a beautiful molecule. And then when it's done being ozone and delivering its electron, it's oxygen, right? It's back to that. So, I mean, when we really think about this, dissolving biofilms and from the topical direction, that's a very important thing. But really, it's an inside job, just like beauty, just like skin. It's an inside. Your dental health is an inside job, right? So, bleeding gums, that's a sign. You know, just like it's not normal. It's not okay for gums to bleed, right? So, and what's driving the inflammation? You know, I talked about the hostage situation in the mouth. So, you know, you have to have the dead teeth removed. They're not okay. We're the only medical profession that thinks, you know, a taxidermy appointment for your tooth is a good idea to get you out of pain. It's flawed completely, you know, and the opioid epidemic that I think my profession started, quite frankly. So when you have a surgical experience through with a protocol and the conditions are right and the microbiome is upregulated, you see, and you go through a septic experience called getting this dead crap out of your mouth, then the pain and swelling later is much, much less. So anyway, I can talk to anybody later about that. But it's, you know, bleeding gums, that's a sign, okay? And
Yeah, so the question is, there's oil pilling, but also what's the principle of using colostrum as a mouth rinse, or do you have any experience with colostrum?
I would say using it topically, I don't have experience with that, but taking it systemically, absolutely.
It's because the salivary enzymes activate a lot of the growth factors in colostrum, which makes sense because when a baby mammal is, you know, suckling off the teeth, the first thing that hits its mouth is the colostrum. That helps to seal the lining of the leaky gut in a young mammal. And so when you're consuming colostrum, this is how I do it, is I'll put a scoop of the colostrum in my mouth and then just hold it and swish it around for about a minute or so and then swallow. But you can still, like, I'll put it in smoothies too, because I make my smoothies super thick, so I'm kind of like working them around in my mouth anyways. You're not wasting if you put it in a smoothie. Just the idea is don't just put it in water and chug it down. Like, it's got to kind of hit the mouth to be fully activated.
All right, so we've got just a few moments left. I've got one more written question, and then if we've got time, we can take a couple more hands. But the final written question is on melatonin and how much should be taken daily, in what form, and is there an optimal cycle between taking it and not taking it? So I'll start with
Yeah, there's
As
a lot of.
many as you can fit into your butt at one time.
Yeah.
Because John's
How many did you get up to? When
A lot.
10 was the last I heard.
Yeah, a lot. Yeah. Yeah. Well, we don't go there. Go ahead, John.
So, rectal delivery of melatonin, I think, is the best timed release, right? So there's a lot of time release products you can take, but they're tiny dosages, which I don't really find the best route as well. So higher dosage, I was exposed to the work of Russell Ryder, who's an MD and a PhD, and he himself, at 89 years old, I think, was taking 100 to 200 milligrams every night. And I watched a YouTube video, and then shortly after I went to Frank Schallenberger's clinic and did an internship with him. And he's prescribing 200 milligrams, sometimes 200 during the day, 200 at night, having people take it day and night, cancer, a lot of degenerative neurologic disease. And he recommended me do that because I was still kind of after my Lyme and my mold. I had a lot of word finding. My brain just wasn't working. And so he recommended that, and it cleared it up, and then some. So you can take larger dosages than what is typically recommended. And the most common argument is that it's going to shut down your own production, which is totally untrue, because you don't have a negative feedback with melatonin like you do a lot of other hormones. So there's nothing to worry about there. And then they've done studies on toxicity, and the word toxic and melatonin should never even be used in the same sentence, because if you look at all the research, like if you take my book and you go through and you pull up some of those articles, what you'll see is the researchers at the end on almost all of them say, there seems to be no toxicity here. We should do more research. And they state all this benefit. It seems to help everything from cancer to gut to infection to healing, skin, mental, emotional, hormone issues. I mean, you name it. It's just incredible. So with the suppository, it takes about 30 to 45 minutes before it really kicks in. So I recommend people take that, a little bit before they're ready to go. We have a liposomal version, and I don't know if there's any other versions in high dose liposomal available besides Sandman, but that seems to kick in quicker. And you can take that even 20 minutes before you want to go to bed. Sometimes people have an effect where they wake up and they're really groggy, right? And they kind of have that melatonin hangover. You might be a slow metabolizer. You're also going to metabolize caffeine slower, so you're going to know if that's you. So you might want to take it like at dinner time, because if you've got light in your eyes and you take melatonin, you're not going to get tired, because that melatonin within the pineal gets activated with darkness, so you can be fine. And that's why 80% of the population can literally take melatonin during the day. And that's why, if there's more significant types of issues that we want to deal with patients, we'll actually dose them day and night, and these people do really well during the day. So you take it a little bit earlier, and the other thing is when you wake up, go out and look at the sun. Get sunlight in your eyes. Get a photon. Use a photon. Do something. You can get a blue light. They sell blue lights that, if it's really rainy, you can turn the blue light on. Well, that's another, it's kind of like with the methylene blue. I know Ben uses it when he travels, right? So he pulses it when he has more stress. So melatonin is the ultimate stress resilient molecule. So, how are you more under stress than when you're traveling? You've got the plane, you're stressing, am I going to make the flight? TSA, you had some issues with TSA. Yeah. That you get snowed in, are you going to make it?
Yeah, so in brief, what I'll do is when I'm at home in my own zone, I try not to be attached to much at all. And once I've recovered from travel, I don't really use melatonin when I'm at home unless I've been exposed to a lot of bright light at night. Occasionally, our family might watch a TV show or something in the evenings. That happen once a month, and even though I wear blue light blocking glasses, I'll sometimes take some melatonin after that. But generally what I do is when I'm traveling and I get to where I'm going, I actually take 2 of the Sandman suppositories the first day when I happen to be outside of my time zone. And then I'll kind of what's that? Oh, what's that come out to?
Well, the Sandman's 200 and the Super Sandman's
around
400.
400 milligrams or so. And that kind of, what's that?
Sorry, are you doing that back to back or spaced out?
No, I just take it about 30 to 40 minutes prior to bed. And then the next night, I'll typically do that again. And then the third night, I'll typically just do 1. And then if I'm having any trouble sleeping on subsequent evenings, I'll cut that in half. When I get back home, I'll do 2 the first night I get back home. And then after that, the only other thing I keep on hand is some of the oral Sandman that John makes. And I'll kind of microdose a little bit with that. So I feel like I still need to come down a little bit. So I'll kind of peak it when I travel and then come down, taper off the dosage and peak it again when I travel. It works fantastically for me. And honestly, I can stop using it cold turkey and I'm fine. But it just takes me, my sleep latency is a little bit longer. And so I prefer to just use it to support travel. And then when I'm at home and I'm kind of back into my normal circadian rhythmicity, I taper off it. And that's my protocol.
Yeah. Well, one other way to use it, just like we talked about with the methylene blue, is if you're coming down with something or you have an infection, there's a huge body of research showing how melatonin basically, we talked about that mitochondrial shift, right? So the cytokine or the inflammation from an infection is going to shut down your mitochondria within your immune cells. So you're not fighting that battle as robustly as you could. So what supplementing with melatonin has shown to do is to turn that energy from the anaerobic back into the aerobic glycolysis within the mitochondria, and you get this 90% boost back with your immune. So anytime you have an infection might be a great time to look at doing higher doses of melatonin. So we're talking about extra pineal, right? This conversation is not necessarily just for circadian rhythm. Smaller doses might be fine for that. They haven't done research on really looking at the full spectrum of dosing and how it might relate to circadian rhythm versus all these phenomenon that we're talking about with extra pineal melatonin. But it is something that could be safe to do long term. I've probably been taking very high doses of melatonin for 4 or 5 years now. And I can stop taking it for a few days or a week, and I feel fine. My Oura Ring scores are still high. I don't fall off a cliff. So I can tell you personally, I've been my own guinea pig, and the research seems to support the conclusion.
Yeah, thank you all for this. We're out of time for this session.